Hey YouTube, on today's video we are going to be talking about parasites. It is the number one problem with small ruminants, sheep and goats. We are going to be talking about everything from how to recognize if you have a parasite problem to how do you treat, diagnose, and things to do as far as prevention. So parasites are obviously one of our biggest problems in sheep and goats. The most of what I'm going to be talking about in this video pertains to the southeast. That's where we're located. Parasites, of course, are a problem all across the world, United States specifically, but in the southeast where we live, our most common parasites that we see are going to be barber pole worms, Coccidia. We're going to see some Trichostrongylus, osteotogi, but the ones that really cause the most loss as far as mortality is concerned are going to be our barber pole worms, and that's going to affect sheep and goats of all ages, and Coccidia, which are going to primarily affect our younger animals. So first we're going to talk about our barber pole worms. Those are basically worms that will cause a anemia in the animal. Basically, it feeds on the intestine, the gut, causes blood loss internally because that's what they do is they take a blood meal, and it causes your sheep and goats to get weak. They start losing the blood supply. The blood is what causes the body to be oxygenated, gives them energy, gives them ability to get out and graze. When you see an animal that is laying around, not with the rest of the herd, their heads down, their ears are drooped, there's a good chance that it's a barber pole worm that's actually causing them to be down. Now we're going to talk about a little bit more about how to diagnose this and get a better idea of what worm it is that's affecting your animal further into the video, so stay with us. So Coccidia seems to be the other parasite that affects our herds in the southeast. They will affect our younger animals primarily. They will usually present as a profuse watery diarrhea. You'll see these younger animals, I'd say less than 6 months of age commonly. They can be a little bit older than that too, but usually you're going to see what you'll notice in your pasture is if you've got an animal that is kind of sunk in, they're not gaining weight well, they kind of have a big belly, but if you look across their back, their top line is sort of not muscling out. They don't have a lot of muscle that gets to be put on. And sometimes they'll actually have kind of dried poop in their hairs around their rear end. That tends to be what you see with a young animal that is affected with Coccidia. Just kind of a poor doer, slow grower, and it can be deadly as well if gone untreated. So now we're going to talk about diagnosing whether or not you have a parasite problem. There is several things that you need to take into account. Parasites do tend to be something that can be harder to diagnose without doing a fecal sample. But you can look at some of these other signs and symptoms as well. So watch for weight loss, animal that is not doing well, they're sort of poor doers compared to the rest of your herd. Look for an animal that isn't gaining weight like the rest of the herd, or maybe it's the entire herd, hopefully not. Look for an animal that has diarrhea or scars. Look for an animal that tends to kind of self-isolate. They keep themselves sort of laying down under the shade while everybody else is out grazing around the pasture. Along with your signs and symptoms, there is something called a FAMACHA that you can look at. You can go on the website. There's a WormX website that you can go to. You can get your FAMACHA card. You can Google. There's a chart that you follow along. Basically what FAMACHA is a scoring system that you look at the conjunctiva of the lower eyelid on your sheep and goats, and you compare the color of that conjunctiva to a color chart on that FAMACHA card. It will tell you, it will score them from 1 to 5, and basically wherever you fall within that FAMACHA card on your entire herd or group of animals that you're looking at is another indication that you may want to have a fecal egg count done and or consider deworming based on your symptoms and signs that you're seeing in your herd. So your FAMACHA scoring ranges from 1 to 5, 1 being basically a color of an animal that is pale. They tend to be almost white, the same color as a sheet of paper, and 5 being very, very pink, almost red. Those animals typically do not need to have deworming right away. I will say, don't use just that, because your time of year, the stress put on the animal, if they're extremely hot, if they're worked up, if they're excited, it can falsely elevate or increase that conjunctiva color. So if their blood's pumping, their heart's pumping, the blood's going through their body at a higher rate due to a stress, you may actually have a animal that is a 2 or a 3 look like they're a 4 or a 5. So don't go just off of your FAMACHA. It's just one of the things that we look at when trying to decide if it is a deworming situation. So one caveat to the FAMACHA scoring is age. If you have an animal that is young, typically less than 4 or 5 months old, they may not follow exactly the criteria for the FAMACHA scoring. Sometimes they're still making red blood cells, their body's still pumping out those red blood cells, the spleen tends to be working, but the parasites are there. That's where the next thing we're going to talk about, being a fecal egg count, becomes of benefit. So part of getting a good deworming strategy together is knowing what your worm burden is in your herd. Again, 20% of your herd is going to shed about 80% of your parasites. So part that we're going to be doing here is getting a fecal sample. All you need is a glove. If you can follow behind a few of them and pick up a poop sample as they go, keep them individual. I'll just take a rubber glove, write the ear tag number to each animal on the glove once you pick it up. Or in some cases, you may have to actually put your glove on and use a little lube and go internally and get a few pellets. You need about 1 gram of poop to run a good, accurate fecal sample. So one thing you want to look for is body condition and how well fleshed these animals are. I tend to pick some of the smaller framed animals that have a little bit more of a backbone showing, and sometimes their hip bones will be a little more prominent. And you really, on a lot of these sheep, you're gonna have to lay your hands on to feel that. Like this one, you can feel the spinous processes sticking up across her back. So I am gonna try to get a sample off of her, run her egg count, see how high her worm load is, and we'll probably get one of these that are a little bit better fleshed, filled out more, just as comparison. Like I said, you don't have to sample every single animal, but if you want to do just kind of a spot check, you know, sample 20% of the ones that you're wanting to sample, and you get an idea of who is your high shedders. So get a little lube, and then you will actually go internally. It'll probably just take 1 finger, go internally, and then scoop some poop back to you. And that's all you need right there. See that poop right there? Consistency wise is a little more mushy. It's not a nice, good round fecal ball. So that's a perfect sample for us to do an egg count on. As we were talking about methods of diagnosing parasite problems in sheep and goats, now we're going to be talking about the actual analytical part of it. So we do what is called a fecal egg count, and this will give you a quantification of how wormy your animals are. We pick 20% of the herd to sample, because 20% of your herd usually sheds 80% of the parasites. Typically pick the ones in a random group. So in this instance, for the case of this video, we are sampling a small group that's in a pasture of 10 animals, and we're picking 2 of those 10 to do an egg count on to kind of give us an idea of where these animals in that group, in that pasture, are. So if these 2 samples have a high worm load, we're going to go ahead and deworm that pasture. Let's start by talking about what exactly is a fecal egg count and how do you do one. You can do a fecal egg count on your own. You don't have to have a veterinarian to do it. You just got to have a microscope. You've got to have fecal sol or fecal float solution, and you've got to have a slide that will read these parasites. So basically, we use what's called a McMaster slide. It is a slide that has a grid pattern within each square. You will strategically fill up this slide with your fecal solution that has been mixed and prepared. And I'm not going to go into nitty gritty details. There's all kinds of videos out there on that. If y'all want me to do a video specifically on that, comment below. But you can do these yourself, or you can have your veterinarian do these fecal egg counts. Now, I'm going to say this: don't just go to a vet and ask for a fecal. If you go to your regular small animal vet, a lot of times they're going to put a slide under a microscope. They're going to let those parasites rise to the top, and they're going to tell you yay or nay whether your animal has parasites or not. Duh. Most animals that eat off the ground are going to have parasites. Okay, so what this test does is better quantifies the number of parasites that your animal has. In small ruminants specifically, you want a parasite egg count to be below 500. If they are below 500, so 500 eggs per gram is what that's measured in. If they're below 500 eggs per gram, then typically speaking, you do not have to worm those animals. That is a low enough worm burden that they tend to do just fine. And just monitor their eyelid color, their FAMACHA, monitor their clinical signs, whether they have weight loss or not. There's multiple factors that can fit into an animal that is right at 500 eggs per gram. Now, if you've got an animal that has 1,000 eggs per gram or more, you want to worm those animals. You likely have a worm shed going on. You have multiple animals in that group that are probably going to be high egg carriers. We use these fecal egg counts as a tool. We use it along with the FAMACHA score, along with their clinical symptoms. We don't just blanket deworm an entire herd. Reason being is, like we were talking about with parasite resistance. Parasite resistance is a big deal. You know, if you just deworm every animal and say you deworm them on a schedule of every month or every 2 months, you are going to end up with resistance in your herd, and it will get to a point, because we only have the wormers that we have. There are no new wormers on the market. There are no new wormers in the works. Once the wormers that we have no longer work, what do? Okay, so that's why we don't just deworm every animal on a routine. You want to deworm them based on their fecal egg counts, and you want to deworm them based on their clinical signs and their FAMACHA scores. If you just look at the worms that are there and you're like, hey, my animal has barber pole worms, I need to deworm them. You don't do that. You've got to get that number. You want to quantify that. You want to make sure that their fecal egg count score is greater than 500 eggs per gram before you deworm them. One thing about doing a fecal egg count, you're really quantifying the type of worm that you have, and you're quantifying what all number of worms are within that type. So barber pole worms, you will keep a tally. You'll count how many barber pole worm eggs you have. Coccidia, really you're going to quantify whether you have a heavy Coccidia worm load. And then you can't just go off of if the poop has worms in it. If you're out there in the pasture, these eggs that we're looking for are microscopic, hence why we're using a microscope. You'll not see these worms in their pile of poop. If you're seeing worms, it is most likely tapeworms, and tapeworms will only be able to be covered by one type of dewormer. That typically is your white dewormers. So you basically, if you're seeing those, don't just say I've got to worm my animal, okay? Because it may just be tapeworms. If it's just tapeworms, you select the appropriate dewormer for the tapeworms. Um, if you're seeing the clinical signs and you're seeing a animal with pale conjunctiva, anemia, basically, um, do a fecal egg count on them, because you're probably dealing with something like barber pole worms, or one of the what we call the hot C complex, so a menagerie of worms that affect small ruminants. That's where doing this fecal egg count will help you better identify the worms you're dealing with, and it helps you to decide what the best deworming strategy is going to be for you there on out. Let's take the fecal egg count one step further as far as its benefit and its effective use. So there is something called a fecal egg count reduction test. What that means is, so let's say you take your herd and you have kept great notes. You got a record sheet here and it says, all right, well, number 213 has, over the last 3 fecal cycles that we have run these fecal egg counts, has run a egg count of 1600 eggs per gram. All right, so what you want to do, what that information tells you, all right, well, you're watching that animal, you realize that she's always consistently had a really high egg count. You deworm, and 10 to 14 days later, after you deworm that animal, you do another fecal egg count. Where that is beneficial is you take that number and compare it to your previous egg count. Say it was 1600. You compare that number and see how much of a drop you have had in that 2-week time frame after you have dewormed. If that number has not reduced by greater than 90%, that is an animal that has a resistance issue. It is the parasites that it has are resistant to the dewormers that you have chosen. That's a huge thing, especially with these small ruminants, these farms that have traditionally seen parasite load after parasite load. Record keeping and doing fecal egg count reduction tests are of great benefit. Those animals that have that consistently high egg count and the reduction tests aren't responding, so you're basically having more than a 90% response rate, you really need to cull those animals and get those animals off your farm. That way it doesn't bring your egg counts to the other animals around them up. You should always have a response to your dewormers. That is what your fecal egg count reduction test is doing, is measuring the response to your parasites in your herd to that dewormer that you have chosen, or those dewormers in a lot of cases. That's why we like that multimodal deworming. It knocks out the worms. If you have an animal that it is not knocking out the worms, that animal's got to go. All right, so this is how we read these fecals. So one of the ewes that we sampled, little lambs, she had 200 eggs per gram. We're okay with that. The other one that we sampled, she had some of the clinical signs fitting. She didn't really have any loose stool. It was a little mushy, a little soft, and it clumped together. And she had a little bit more of a failure to gain weight. Her top line wasn't filling in as well. She wasn't as rounded out with muscling. Her sample actually ran about 10,000 eggs per gram. So she hasn't been dewormed since she was weaned. We always deworm them at weaning time just because of the stress of weaning. She hasn't been dewormed since then, so that's been over 6 months. This little lamb that has that high of an egg count we're probably going to put a copper oxide wire bolus in her also. She does have a really high count compared to the other one that had 200, so we're going to keep her on our watch list. If she continually runs high, of course, I don't think she's had a chance to build a resistance, so I doubt her problem is a resistance issue rather than a issue with her actually just being more susceptible to worms. She may be part of that 20% that I'm talking about that shed 80% of our parasites. So we're going to watch her, we're going to deworm her and check her again in about a week, make sure she doesn't have or 2 weeks rather, make sure she doesn't have a consistently high egg count. And then I'm probably going to keep a check on her and double check her again in about 3 months. So I want to talk about parasite resistance for a second. In the southeast, parasites have seen so many varieties of dewormers. They've seen feed-through dewormers is probably the biggest one that has caused a resistance issue. Not everybody is the best at guessing what an animal weighs. So what I recommend first and foremost, get you a set of scales, get you a way to actually get an accurate weight on your animals before ever considering deworming. What we've seen cause resistance issues is constantly underdosing animals that weigh more than what we think they weigh. The parasites have seen such a low dose of dewormers that they have actually started building a resistance to the dewormers. Another thing that we see is feeding, the feed-through dewormers. Not every animal is getting the exact dose that you want them to get with that feed-through. You may have a bigger, more ravenous appetite animal come through and eat more of your feed-through granules than an animal that is actually smaller frame, not growing well. Well, guess what? Those smaller frame, not growing well animals are usually the ones that have the parasites. So if you're trying to do the feed-through wormers, I don't recommend it. There might have had a place years ago, but it's not working anymore. Basically, you want to use a multimodal treatment protocol for a lot of these parasites. So on the topic of multimodal deworming, due to parasite resistance, they are now recommending using 2 or more dewormer classes. And what I mean by that is there are classes of dewormers. Everybody's familiar with your ivermectins. Everybody's familiar with Safeguard. Everybody's familiar with basically like Sidectin. All of those have their own class. So what I typically tell people is you want to use a white dewormer. That's usually your fenbendazoles, your valbazins. That's your white dewormer class, and you want to pair it with a clear dewormer class. So ivermectin, Sidectin, and I will even throw in a third class on some of ours that are very wormy, and that is your levamisole. That is a clear dewormer still, but it's in its own class. We've had such a resistance issue here in the southeast that throwing that third class in there really tends to knock out the parasite burden. So this is basically your levamisole, another brand name known as Prohibit. It is one that you do have to mix and read the directions on the bag. This is one that's very dose dependent, meaning that if you don't have an accurate weight on your animal, it is very, very easy. The margin of safety is very narrow. It is easy to overdose these animals with this one. So be very careful if you use this one. As long as you mix it according to the label directions and you dose it based on the animal's weight, it is safe. You can use it, not a problem. You can use it in pregnant animals, nursing animals. It is good all around dewormer. You just got to be accurate on your mixing and your dosing. So the next dewormer that we use often here is Sidectin. It is able to be obtained through your feed store, Tractor Supply, Premier One. We use it at the same time as these other dewormers. We dose them all on the same day. You don't want to split up the days between. Dose them at the same exact time. There is a chart on the back of the dewormer that is still accurate for sheep, but the dosage due to parasite resistance has changed for goats. If you go to wormex.info, it's the basically there's a chart down there for sheep and there's a chart down there for goats, and it is the most recent information, the most recent data on deworming. It will give you a dose for the oral. Another thing I want to talk about real quick is the difference in using this oral cydectin and the pour-on cydectin. Use the oral. Use it. It's going to work far better than using the pour-on. I know there's some folks that want to give the pour-on cydectin orally. Don't do that. You'll actually get ulcerations, burns. It irritates the mucosal lining of the GI tract, esophagus, stomach. It's not good to use the pour-on orally. The carrier they use to get that pour-on into an animal through its skin is what is so harsh on the lining of the intestine. So our third class of dewormer that we use here is valbazin. It is in that fenbendazole drug class. I will say, don't use this one if you have an animal that is pregnant. We will typically use this one on our animals after they lamb. They usually have a worm shed, so the stress of lambing and kidding causes those parasites in the gut to flourish. They basically will release, and as the mama's walking out through your pasture pooping, there's a higher load of parasites being put out on that pasture for these little new babies with a naive GI tract to come along and graze and ingest. So only use this on your mamas or even rams or billies that haven't, basically animals that aren't pregnant. This is safe for. Wide dosing margin, a lot of room for error there. It's safe, just not if they are pregnant. So this is also another, the valbazin is another product that you're going to need to go to the wormx.info website and get the most accurate, most up-to-date dosing information. It typically, the dose that's on the bottle typically runs about 4 to 6 times lower than what it actually takes to treat a worm, to treat a worm infestation. So that wormx.info, they update that yearly. It may be different today than what it is a year from now if you're watching this video. So go check wormx.info, look for your sheep and goat dosing charts, and they will give you the most accurate, most up-to-date dose that basically is above what we're seeing resistance problems with. So lastly, on the note of treatment for parasites and trying to prevent resistance problems, we're going to talk about, it's kind of a controversial topic, especially with sheep, but copper wire boluses. So basically you will use copper oxide. They are wire particles that they grind up and put into a small capsule that you give orally as a bolus to sheep and goats. Everybody is always afraid of copper and sheep. Sheep are basically very, very sensitive, very susceptible to copper toxicity. The levels accumulate in the liver, and a stress can cause them to die. With these copper oxide boluses, as long as you follow the right dose, you will be okay. For sheep, they recommend, basically for an adult animal, a 2-gram wire particle bolus. We typically will only save those for our animals that are our highest worm shedders. So in a herd of animals, traditionally speaking, about 20% of your herd are going to shed 80% of your parasites. So when we pick out our herd, we do our fecals, we do our FAMACHA scoring, and we pull out that 20% of our herd, I'm going to put a wire bolus in those higher shedding animals. That wire bolus will compete with the gut, and it raises the levels of copper in the body, and it prevents those parasites from growing. It basically is needed, just it has to be based on the dose for each animal. Lambs, kids, they get less, they get between 1/2 gram and 1 gram. And then in goats, because they aren't as sensitive to copper, they can get between 2 and 4 grams of a wire particle bolus. So there's all kinds of products out there. I don't have an example of one right here to show you. I'll try to post one in a link to it in the description below. But yeah, those have worked wonders for our herd. The high shedding animals get that copper bolus in them, and they have had a much more favorable outcome in throughout the year as far as not shedding as many parasites after they've had that copper bolus. Okay. So it's also very important to make sure that you have a nice dry environment, clean environment for your sheep and goats to go. A lot of times the parasites like a damp, dirty, moist, poop-filled environment. All of those dewormers that we just discussed are really targeting our parasites that we consider a hot C complex. That's Haemonchus, Ostertagi, Trichostrongylus, and Couperia. That's your main parasites that will affect the gut of a small ruminant. Aside from Coccidia. Coccidia is one that here in the United States does not have a great treatment for. The biggest thing that we can do is prevent Coccidia. Coccidia can be prevented by adding a medicated feed to their diet, to your kidding and lambing protocol. You also can feed through a medicated mineral. We actually do a medicated mineral. Just looking at the mineral, you can't tell, I don't see medicine in it, but it will say on the bag when you buy it, it's medicated. A lot of them will use decox. So we feed a medicated mineral. One that we uses dequinate or decox. You can actually get feed that has the same stuff in it. If you're feeding out your lambs, if you're using a creep feeder, I would recommend using a feed that has the decox added to it. And overall, it will help prevent. It's basically what's called a Coccidia stat. It's not Coccidia cidal. It doesn't cidal meaning that it kills the Coccidia. It doesn't kill Coccidia, but since it's a Coccidia stat, it means it inhibits the growth of Coccidia. So if there's Coccidia there, it prevents it from growing, prevents it from causing illness in your lambs and kids. So we will also add our medicated mineral and feed to the mamas about 6 weeks prior to them lambing. Getting that in their system, it helps them to prevent, during that stress of kidding and lambing, it helps them to prevent that shed of the Coccidia eggs onto the environment. So 6 weeks prior to kidding and lambing, start them on that medicated feed and mineral, and that will significantly decrease the chances of you having a parasite shed from the mothers. Now we're going to talk about a little bit more from a preventative standpoint of preventing parasites. A big one is going to be rotational grazing. It's a big topic. It even pertains to if you have cows. Rotational grazing by far will reduce your parasite burden. So what I mean by that, as you can see here, this is just a Premier One netting. We will actually stretch it between pastures, between boundary fences, and we will move it. We will actually section off and let them graze till it's down below 4 inches. And then when it's below 4 inches, we will move them into another pasture. We try to let them graze that pasture when that grass blade length is between about 6 and 8 inches tall. When it starts to get below 6 inches, it is time to move them to a new section of pasture. If you think about it, common sense, an animal that is grazing closer to the ground are going to be more likely to ingest parasites that they have pooped out on the ground already. So you're basically, by rotationally grazing them, you're moving them off of an area that they have already grazed down too low and pooped on, therefore reducing their intake of parasites. So in goats, they are basically what we consider browsers. Kind of along the same lines of what we was talking about grazing the grass blade no lower than about 6 inches. Well, while goats can graze, they thrive, they do much better if they are able to browse. What I mean by browsing is a leafy plant, not a grass blade, not something with a little stem to it, but something leafy, privet, basically anything that grows in a tree line, in the woods. Goats tend to do better with that. So make sure you don't just put them in a backyard somewhere with just real short grass, because you will have, I can guarantee it, a parasite problem if you do that. Nutrition is another big thing as far as preventing parasite problems. As long as your animals have a high plane of nutrition, they are well fleshed, meaning that they have appropriate amount of muscling across their back, across their hips, across their ribs. They are strong enough to fight off a certain level or a certain load of parasites. All animals are going to have parasites. Okay, any animal that's out here grazing off the ground in the outside world, they're going to have parasites. What we are shooting for is a manageable number of parasites, and that's where our fecal egg count comes in. Knowing what their number is, knowing if their number is high enough to need to be treated yet or not. So let's talk about nutrition. Feed them based on the recommended feeding rates. If you're feeding them a feed from a feed store, be sure to read on the label. Make sure you're feeding them the appropriate pounds per head per day that the label recommends. Same thing with pasture. You know, if you have animals out on pasture that is grazed down to the ground and they're just nibbling off as low as they can nibble to get enough grass to maintain them, that's not a good nutrition. That's not a good forage or a good plane for them to stay healthy enough to fight off parasites. You want to have a good stand of pasture grass. If it's goats, you can even incorporate woods or brushy stuff, as long as they're browsing and eating something green, something leafy. And through the wintertime, you want to feed them in feeders that are off the ground. One thing a lot of people don't think about is when you're feeding an animal and it's a trough that sits on the ground. Sheep and goats especially, they like to lay in their troughs, they like to walk in the troughs, they turn sideways while they're eating out of the trough. If that trough is up off the ground, they are less likely to do that. And the reason that's important is if they're eating while they're standing in the trough, if you notice when animals are eating, a lot of times they will poop. So it comes in one end, out the other. Well, if they're pooping right there where they're eating, it's basically a vicious cycle of parasites. They're basically all the animals coming along behind the one that's standing in the trough pooping are going to end up with the same parasites that animal just pooped out. So raise your troughs, raise your hay feeders. Don't let them be eating off the ground. You want that up off the ground, about chest height for your animals. If you've got small animals and big animals, if you can separate them into pastures, that way you can treat them for their appropriate size. You know, you don't want to, if you got a ram that's, you know, this tall and you've got a bunch of lambs running around in there that's that tall, obviously your ram's going to be able to get over into the trough and poop where your lambs are eating. They may not be able to get in there, but it will happen. So short troughs for short animals, taller troughs for taller animals, and that will cut down drastically on your parasite reemergence, parasite cycle. Lastly, I'm going to talk about the animals that, the 20% that are your high parasite shedders, if you have chronically been treating them, deworming them, doing all the preventative measures, and they are still shedding a high load of worms, they always carry a high worm burden, you're kind of left with culling that animal. I know a lot of people are attached to their animals. We are also, but if you have an animal that is a chronically high shedder, the best thing you can do for your entire program is to cull that animal. We always say, joking around, that's trailer mycin. Basically, a treatment is trailer mycin. We'll put them on a trailer, send them to the sale, send them to a feed yard, get them off the farm. Those animals are maybe good animals, but they are keeping the rest of your animals, keeping your program from growing, keeping it from being as good as it can be. So culling is never a wrong answer. On those that you know consciously that they are chronic worm shedders, be kind. Don't sell those animals to other producers, because if they have that worm problem at your farm, they're going to have it anywhere they go. Don't pass those animals along. When you cull them permanently, sell them for meat, take them to a terminal sale somewhere where they can't be utilized on a pasture situation any longer. All right, guys, that concludes the video on parasites. Y'all have a lot to say today. So if y'all enjoyed this video, please like and subscribe. And if you have questions about anything, comment down below and I'll be happy to answer them to the best of my knowledge. I'll post links to everything we talked about in the description. If y'all like this stuff, please give me some feedback. I'll make more videos, more informational type videos, and do the best I can to get y'all some good, accurate information. As always, guys, thank you for watching, and we'll see y'all on the next one.